Hi, my name is Dr. Manjula Rao. I am a consultant breast cancer specialist and oncoplastic surgeon working at Apollo Proton Cancer Centre in Chennai. So today I'm going to be addressing a few questions on breast cancer, the common ones that are usually asked. What is breast cancer? Now, cancer refers to an overgrowth of cells in any one part of the body. And when that happens in the breast, it's referred to as breast cancer. What are the signs and symptoms of breast cancer? The most common symptom of breast cancer is a lump in the breast. It may be palpable, and sometimes when it's very small in the early stages, it may not be. What are the different stages of breast cancer? Now, any cancer, they typically have 4 stages, stage 1, 2, 3 and 4. And how do we go about staging the disease? We look at the tumor size, the size of the tumor first. We look at how many nodes, the regional nodes, how many lymph nodes are involved by the cancer or may be involved. And thirdly, we look at how much has the disease spread. Is it restricted to that particular organ, for example, say the breast, or has it spread to other parts of the body? So, who are mainly affected by breast cancer? As you all know, and I have mentioned it before, breast cancer is the commonest cancer today in the whole world amongst both men and women. But of course, it's the most common cancer that's prevalent in women. But does that mean that men don't get breast cancer? No. Men can also be affected by breast cancer. So to put it simply, anyone with breasts can develop breast cancer. What age does breast cancer occur? Now, breast cancer typically, traditionally, has been referred to as a disease of the older age group. So it's most commonly the median age of occurrence in women is said to be around 50 to 55 years of age. In India, however, we do notice that and there is data supporting this, that breast cancer occurs in women a decade earlier than what is considered normal. So we do see a lot of women in their 40s, early and mid 40s also developing breast cancer. So what age can one develop breast cancer in? Though the most common, of course, are between the 40s to 50s and after, it can occur at almost any age. We've also seen, very rarely, but we have seen women in their 20s and 30s also develop breast cancer, and sometimes even younger. So how common is breast cancer? Now, breast cancer is the most common cancer in the whole world. Initially, lung cancer used to be the most common, and in women it used to be cervical cancer. But over the years, we've seen a gradual increase in the incidence of breast cancer, and last year in 2021, the WHO declared breast cancer as the most common cancer in the world amongst both men and women, and also the most common cause of death from cancer. What are the different types of breast cancer? Now, breast cancer typically we divide it into 2 types. The ductal type, that is, it can arise from the ducts or in the breast, which is the most common. Around 75% of cancers end up being invasive ductal carcinomas. Or it can also arise from the lobules of the breast. That is known as invasive lobular carcinoma. Can breast cancer occur in other parts of the body? Now, breast cancer obviously refers to cancer arising from the cells of the breast. However, we have seen breast cancer arising independently in the underarm area as well, or the axilla as we call it. And of course, a biopsy would tell you as to whether it's arising from the axilla, from the nodes, or whether it's a breast cancer per se. And of course, breast cancer arising in the breast, it can spread to other parts of the body. So it would still be breast cancer that has spread to other parts of the body. So yes, it can occur in other parts of the body, but then that would mean that it's slightly more advanced disease. What are the early signs of breast cancer? So the earliest sign of a breast cancer and the most common symptom rather is of course a lump. But the other early signs that one must look for are any skin changes. Does one breast appear bigger than the other, which is suddenly changed from the normal? So normally, even if you have two different breasts of different sizes, is suddenly looking more bigger or maybe more smaller than the other. Now, what are the causes of breast cancer? There is no one particular cause that is certain to be responsible for breast cancer occurring. However, there are many factors that increase or decrease one's risk of breast cancer. Now, the estrogen hormone, which is the predominant hormone coursing through a woman's body, is said to be responsible for giving rise to breast cancer. Now, for the important bit, how is breast cancer diagnosed? In order to diagnose breast cancer or any type of cancer, what is very important is a biopsy. So, in order to diagnose breast cancer, the first thing that a doctor would advise you to get is a core needle biopsy of the breast lump. Now, how is breast cancer treated? The treatment for breast cancer is not one, it's multidisciplinary. It involves surgery, it involves chemotherapy, it involves radiation therapy, amongst others. These are the three main. Is breast cancer fatal? Now, the prognosis of breast cancer really depends, of course, one, on the character or the behavior of the lump or the cancer. And secondly, most importantly, what stage has the patient presented in? Somebody who has presented in locally advanced or advanced stages of the disease definitely may do poorly. But that does not mean that it is fatal. Breast cancer today, I'm very happy to say, is a very treatable condition and in some cases even curable. So, it's important that we catch it early. So, catching the disease earlier means less intensive modalities of treatment. When should one consult with an oncologist or a breast surgeon? I would say if anyone notices anything different in their breast or in their underarm or the general area, say even a neck node or a lump or swelling in the neck, it's very important that you see a breast specialist or at least an oncologist to find out if there is anything wrong. So, stay healthy, stay safe and stay informed. And of course, in the case of any complaints or anything out of the ordinary, please do go meet your doctor.